Hi guys, welcome back to my channel, and if you're new, thank you so much for joining us today. My name is Hannah and I'm a sexual health nurse. Please like and subscribe for all things sexual health, relationship and contraception. Today, the thing we're going to talk about is the herpes simplex virus. The herpes simplex virus, also known as HSV or herpes, causes ulcers on the genitals and also the mouth. There are two strains of the herpes simplex virus, HSV1 and HSV2. Now, originally HSV1 tended to cause ulcers on the mouth and HSV2 caused ulcers on the genitals. However, due to an increase in oral sex, HSV1 can be found on the genitals and HSV2 can be found on the mouth. Herpes is sexually transmitted, and it's sexually transmitted through skin-to-skin contact. So condoms do help a slight amount in preventing the spread of herpes because less mucosal skin is coming into contact. However, it does not completely take away your risk of developing herpes, and you may, despite your best efforts of using condoms, still contract the virus. Symptoms tend to develop within 2 to 14 days after contracting the virus. However, it's really important to stress that only 1 in 3 people will develop symptoms. Also, just because you've developed symptoms now does not mean that this is when you've contracted the virus. You may have contracted it earlier and just be showing symptoms now, or you might have missed your first episode. Symptoms will start off on the mucosal skin, a little bit of soreness and maybe a slight itch. Then you will develop some blisters. They tend to look like fluid-filled bumps, and they can be there for a couple of days until they pop and you develop an ulcer. The ulcers tend to be really painful, which is why we can distinguish them a lot easier from syphilis ulcers or chancres, because herpes ulcers tend to be extremely painful to touch and also just in general. A lot of people find that they struggle to pass urine when they have the symptoms. Please, if you're struggling, hop in a bath and wee in the bath. That's the best thing that we'd advise. A little bit of ibuprofen, lidocaine gel, things like that. Once the ulcers have gone, they'll begin to scab up, and then once the scab has fallen off, you'll be left with fresh healed skin. Normally, herpes do not cause any scarring on the genitals or the mouth, depending where you've got them. Your initial symptoms can last up to 3 weeks. However, rest assured that if you do develop symptoms again in the future, they will only last a few days. A lot of people find that they get what's called prodromal symptoms. About 90% of people will have these symptoms before they develop the ulcers after their first bout of symptoms. This can be anything from a slight tingling to a shooting pain that can go down your buttocks, your legs, or your hips. This happens a couple of days before you develop the ulcers, and this is a really good time to get in contact with your sexual health clinic so we can start you on some antiviral medication, acyclovir, and prevent you from having the ulcers develop. Once the ulcers have developed, taking acyclovir is not really going to be of any benefit for you. It's a little bit pointless. However, when you have your first lot of symptoms, we do give it to patients. The reason being is that we don't know how bad your symptoms are going to get. So this could just be the start. So we want to give you some acyclovir to prevent you from getting your symptoms even worse. Now, herpes tends to be diagnosed by a clinical diagnosis. However, we will take a little swab from the fluid of the blister and send it off to diagnose type 1 or type 2. The reason being is just so we've got a little bit of understanding as to what type you've got. Type 2 tends to lead to more recurrence of symptoms. However, just because you've got type 2 does not mean that you're going to get loads of symptoms. So don't start worrying. Herpes is a virus that stays in your body. No, you cannot get rid of the herpes virus. Once you have it, you have it. However, about 70% of people actually carry the virus. a lot of them just don't show symptoms. We don't tend to do blood tests because the only time you'd need to actually be treated for herpes was if you had symptoms. So actually testing you for it and doing a blood test, you're probably going to come back positive. And what have we gained? Nothing, because we're not going to do anything about it. What's really reassuring for you or your partner is that about 70% of new infections come from people that do not know that they're infected with the virus. So if you have herpes virus, are actually quite a safe sexual partner to have. You're the most contagious when you have symptoms, so do not have any type of sex. Oral sex, vaginal, anal, just avoid all sex until your skin has completely healed. Within the first year after contracting the virus, we know that you are the most contagious, and you can also have what's called asymptomatic shedding. So this is where you don't have any symptoms, but you're still passing the virus on. Within the first year, you're about 5 to 10% likely to pass the virus on to your regular partner. So by avoiding having sex or sexual contact during symptoms is the best way to prevent your partner from contracting the virus. Where does the virus live? The virus actually lives in the spine. That's why you get the tingling and shooting pain just before you develop the symptoms once you've had your first bout of symptoms, because the virus starts to travel back down the nerve and come to cause you to have symptoms. Now, unfortunately, herpes is more common in women because they have a lot more mucosal skin on their genitals. If you do develop herpes, please don't worry. We can help treat you with antiviral medication to prevent your symptoms from coming back and back and back. If you're somebody that gets a lot of recurrence of symptoms and many episodes that you're finding is causing a lot of anxiety and worry and also discomfort and pain, then get in contact with us and we can start you on a suppressive therapy. Now, a suppressive therapy is where you would take the antiviral medication daily and it will keep your symptoms suppressed and prevent you from getting the ulcers. You can be on this treatment long term. However, it's really important to note that most adults that carry the herpes virus are either asymptomatic, so they do not have any symptoms at all, or they fail to notice the symptoms when they get them because they are so mild. Thanks so much, guys. I really hope you've enjoyed the video. Please don't forget to like and subscribe for more sexual health, contraception and relationship advice. Take care. Bye-bye.